Mayor Tory to speak.
Well, thank you, Madam Speaker, and I'd like to begin. It's not always the case we can do this in here, but there are times when you can and you should, and I'd like to say that I want to associate myself with every word that Councillor Gord Perks just said. And I want to, like others have done, begin my own remarks by saying thank you to Councillor Joe Cressy and Councillors Joe Mihevc for their leadership, especially, I'll say, and this is no disrespect to Councillor Mihevc, Joe Cressy, who has, I think, taken this process through, this process of consultation, and brought us to today in a textbook way that it should be done, which included huge involvement of people in the public, a huge degree of consultation, a great deal of care and sensitivity. And the same with our staff, led by Dr. McEwen and others. And, of course, as Councillor Perks just said, those who had the courage to come forward and help us to understand this issue. And I was one of those people who had to understand more and better. My first exposure to this issue came in 2003 when I was running for mayor at that time, and the Toronto Star at the time they came and asked you a question every day during the election campaign, but they didn't tell you in advance what the question was. And I think almost the first question, the first day, for me as somebody who had not run for public office ever before, was what did I think about this issue? And my answer, I don't remember exactly what I said, but I remember it articulated a discomfort that I had with this, for some of the reasons that have been articulated in here today. It just didn't sort of add up to me, and that's what I said. And I think it's some of the same discomfort, if I can use that word, that people still have today. They have a degree of empathy and sympathy, but they still have a discomfort. So fast forward to today. I had a chance to have an initial briefing from Councillor Cressy in my office, and then I went, and this was instrumental to my own, as I said the other day, in honouring Dr. McEwen's retirement. I went and had a briefing at the Victoria Street clinic and facility operated by the city, and I thought about myself after that experience, and I thought about things that I say all the time in another context and realized this was no different, and it really feeds off some of what Councillor Perks just said. I said, in being an outspoken advocate on behalf of those with autism and families with autism, that how could it be that we could relegate people who have an illness of the brain, in the case of autism, to second-class treatment, where we sort of say to them, well, maybe we'll get around to it, or maybe over time you'll put your name on some list, or, you know, something like this will happen. And it was second-class treatment. We would never say that to anybody with diabetes or with a heart disability. We'd look after them right away. And I realized, in thinking about what I had said over the years about those people, some of those people who, I won't say deliberately, just inadvertently, we thought somehow we came to the conclusion was okay, that they got a different standard of treatment and had a different set of rights, that it wasn't right, that if you were really fulfilling the obligation we had, not just as a health system, but as people entrusted with responsibilities in public life and in the administration of our city, and just as human beings who share a city here with others, that the notion that you could have people needlessly die. And this is where the briefing came in, because I frankly had no idea. You know, I've been here for 18 months, but I had no idea as to the toll that was taken, because frankly these numbers don't get a lot of attention, not as much as they should. But I had no idea as to not only the numbers but the trend lines that were existing in our very own city of people who were needlessly dying alone in the city when they had a challenge in front of them that resulted from addiction, which is an illness. It's an illness. It's something that should be dealt with better than it has been by the healthcare system. And there are many of these people, and many of these deaths, of course, are preventable, and that's another thing I learned from the briefing. I'm sad to say that there are dozens and dozens of these people that we never hear, we never really know their names. We don't hear their names, we don't hear about them. But they are fellow human beings, they're fellow Torontonians, and they are the people that I think we are here to most look after. People who are particularly vulnerable, who need a special degree of help or support or assistance of some kind. And I won't have time now because I'm running out of time, but I got an email from a friend of mine, a long-standing friend, and somebody who's also a very respected professional in this area, Dr. Dan Cass. And his medical practice is now confined to addiction medicine. And he wrote me about Brooklyn McNeil, and he said it was okay that I talked about his email to me, and it was about her, and she was a patient of his. And he simply said to me, and I had seen it in some of the write-ups about her and her intentions to appear in front of our Board of Health and actually help us with this issue, and she helped other people who were experiencing a drug addiction and so on, and that she herself ended up dying alone, knowing what the solution was, coming to tell us that we should do what I hope we will do today, and that she died there alone in an alley in our city when she'd had the courage to come forward and talk at the Board of, well, she was to be at the Board of Health, but she'd been elsewhere. And I just said to myself, I concluded and informed Councillor Cressy before that time that I was going to support this, that, you know, those are the people. We happen to know her name, but there's lots of others we don't, that we most have an obligation to help and to support in this city. And that I'm confident that the public health authorities will do this, and the agencies that are going to be administering these programs will do it in a vigilant and diligent and careful and sensitive way, and that they will work as well to make sure that hopefully the public health authorities and the provincial government, let's put it where it is, the healthcare system will do more to help these people to get off drugs. But in the meantime, I think this is the right thing to do. It's the moral thing to do. It's the thing to do that is going to make a positive difference and save lives, and hopefully give some of those people who might otherwise have died alone, like Brooklyn McNeil did, a chance to live a full life, freed of some of the immense challenges I can't even imagine that they face in that circumstance. And so I'll be supporting the recommendation. Thank you, Madam Speaker.
Thank you.